Gregory Johnson. We have Bruce who's visiting us here this afternoon after watching our YouTube videos and finding us online. As you can see, Bruce has got some abnormal biomechanical configurations which are consistent with severe scoliosis, and you can see how far his head's forward. He's got this big kyphosis in his upper thoracic spine, and that's an increased curve in the upper thoracic spine. And you can see the scoliosis out here to the left and then over to the right down here, which has shifted his pelvis way to the right of center and his head way forward to the left. So Bruce, I'm going to have you close your eyes and bend your head forward all the way and then backward all the way. Now see, on extension, he got a very limited extension. He doesn't even bring his ears over his shoulders. Now back to normal. And see, normal for him is way forward and down. So he's got forward translation on the z-axis. He's got translation to the left on the x-axis. He's got translation in the pelvis to the right on the x-axis, as well as the thoracic spine on the x-axis. Now here's the amazing thing about Bruce's case. Bruce, I'm going to have you lie on your back for me here first. We're going to do the exam on Bruce today with your head up here. Yes, sir? And change this paper for you. So you're going to get to see me do an orthopedic neurological exam today. Now see, look at Bruce's head, can't even lay all the way back. So I'm going to lift this table up for you, Bruce. Try see if you can even get it back on. That's as high as I can get my table.
Well, the only other way I can do is up like that.
Okay. Okay, go ahead and lay flat though. Now see, even laying flat, he can't even touch his head, and I've got the elevation up here, what, about 6 inches, Joseph?
Yes, sir.
So the first test that I'm going to run on him is called the straight leg raise test. And I'm going to lift this up, Bruce, and tell me, besides the tightness in your hamstring, does this cause any lower back pain or shooting leg pain?
No, sir.
Great. Is there any low back pain or shooting leg pain when I do that?
No.
Okay. That's a Braggart's test, negative. Now I'm going to push down here, Bruce. You tell me if it hurts in your hip joint or your back when I do this.
No.
Great.
Was it supposed to?
No, not if you're normal.
Okay.
Yep. Now, is there any back, besides the tightness in your hamstring, is there any back pain or shooting leg pain?
No, sir.
Great. And how about here?
No.
Okay, good. And we're going to push this down. Is there any hip pain or back pain?
No.
Great. So he's got negative orthopedic neurological tests for his lower extremity. Push against me. Push against me. Pull up. Turn in. Turn out. He's strong as an ox. Okay, good job. Now, I'm going to push forward here. You tell me if this hurts anywhere in your spine.
No.
Great. See, let's turn you on your tummy now, please, sir. So he has 0 positive orthopedic neurological findings right now.
In here?
But as you can tell, his spine, yes, sir, just like that. And you rest your arms right there. You can see how much of a kyphosis he has here in this upper mid back. Now, Bruce is not here because he's in severe pain. He's here to improve his mobility and keep his scoliosis from degenerating over time. Now, Bruce, I'm bringing your legs up. Tell me if this hurts in your lower back at all.
No.
Or your thighs.
Just no.
A little tightness in your thighs?
No.
Not really?
In the knees.
Okay. So that's negative on Nautilus and Deerfield. That normally would be tender right there. Is that tender at all?
No, sir.
So see, his pelvis, even though it's rotated out of place, people adapt to conditions over time. And I think that God has actually blessed Bruce with having this condition and not experiencing any pain associated with it. Now you can see he's got a significant thoracic kyphosis here and a curvature laterally as well. But he's not hurting anywhere. None of this is sore, is it?
No, sir.
He's got tight muscles here in his neck and shoulders, but they're not sore or painful, are they?
No.
And your neck's out right there on the right. Is that tender at all?
No, sir.
So he has no pain whatsoever, so very good. He has come in here for my professional opinion. Okay, I'm going to have you raise this leg up. No, just lock it straight and raise the whole leg up.
I can't do that.
Can't do that?
No.
Okay, do the same thing over here if you can.
No.
Okay. All right, you can relax now, and let's set you up face towards Joseph. There we go. Now, Bruce, you tell me if this hurts anywhere in your spine.
No.
I say foramen compression. I'm going to try to bring your head back a little bit.
Yeah.
And we're going to go left or right, and I'm going to push down. Does that hurt anywhere?
Nope.
Okay, we're going to go back. And see, he can't even really go back and to the left. Is there any pain when I do that?
No, sir.
Okay, how about when you just tilt your head this way?
Nope.
See, he has no range of motion. Everything's just locked up. I suspect, and we're going to go ahead and order x-rays on him. Is there any pain there? How about when I do this?
I'm sorry.
Okay, that's fine. No, you don't need to be sorry. Praise the Lord. Now, I'm lifting up. Is there any relief of this, or does that change anything?
Didn't change.
Doesn't change a thing. Okay.
No.
I'm going to push down. You resist. Hold this up. Excellent. Good strength. Good strength. This is the orthopedic neurological test that we run on every patient before we see them. Okay, I'm going to pull out. Resist. Good. You're strong. I'm going to push you in and resist. Excellent. Triceps and biceps are normal strength. I'm going to pull out.